the Know live on WJZZ Cool TV. We are streaming live on Facebook, YouTube, Twitter, Twitch, and other top social media networks. I am your host, Cassie. I would love for you to please follow me, like, subscribe, all of that good stuff. Thank you again for joining us and watching In the Know. Uh, Again, your host, Cassie. My co host, Kim, is off again today. Kim, I hope you are at home just relaxing. I will be seeing you soon, probably tonight, girl. I just want to give a shout out to you. Today, we will be joined, or we are joined by Mary again. We will continue our conversations on women's health. We had a very in-depth discussion last week. Actually, it was an awesome show. You gave us lots of really, really good information, and I appreciate you for joining us again. Thank you so much, Keisha. I want you to just introduce yourself to the audience again for those that didn't see the show or, happened to miss the show last week. Can you hear me, honey? Can you hear me?
I can hear you. You're going in and out.
Okay, okay. So just introduce yourself to
I can hear you now. I'll
okay.
introduce myself.
Yes, yes. Introduce yourself.
Hi, I'm Keisha Perry, and I've been a nurse. I've been a nurse for over 21 years. My specialty is med surg nursing. I've worked as a case manager. I've worked in home health care. I've worked as a state tested nursing assistant instructor. I've also worked at various hospitals throughout the area. I've worked as a travel nurse. And I'm the CEO of Infinite Effects, which is a woman's empowerment business, and basically it helps with the development of personal goals and more motivation and things of that nature. So I do a lot in the community with women. That is my passion, and that's why I'm here today to speak to you guys about health and wellness.
Wonderful, wonderful. I thank you for being here again. I know that last week you started off with telling us about the anatomy and physiology of the female reproductive system. You also discussed the signs and symptoms of menopause. We went over the myths. We went over treatments. We went over quite a bit last week, and I just want to kind of recap just a little bit about what we did last week for those that did not, um, you know, were not able to view that show. So just want to do that little recap. So I'm going to start off with asking you, after a person has a hysterectomy, I'm sure their hormones are all over the place. It's a well-known fact. Hormones are all over the place. So tell us what happens with a woman's normal flora. If a person has that type of situation where all of their hormones are out of whack, it's definitely going to imbalance you. It's going to mess up your normal flora. So tell us how that can affect the body, some of the side effects. Um,
Mm-hmm.
just tell us about how that will affect the body. What could you expect if you're off balance, if your normal flora is no longer there? And tell us what the normal flora is.
Okay, so okay, so first of all, the normal flora is a bacteria that is in your body. And yes, is a bacteria, but it's a normal bacteria. It's a healthy bacteria. It
Yeah.
helps fight off the bad bacteria. So we always want the normal flora. We always want some type of bacteria in our bodies. That's,
Okay.
it's normal. So the flora in the body, it changes during menopause, and there's like four distinct odors that your body may have because of the change in your body's normal flora because of menopause. So
Oh,
first of all, we'll talk about, probably we'll get the dirty things out of the way. We'll discuss those first. So you'll notice, like I mentioned last week, the hot flashes, the cold, the night sweats. So with that, during menopause, you have a natural scent or a smell, or the smell of sweat intensifies
Okay.
because there is a drop in the estrogen level, and it can produce, like I said, the hot flashes and the night sweats, which can cause excess sweating. And when the body tries to cool itself off, what happens is the sweat, it builds up on the body, it's not absorbed, and then the bacteria feeds on that sweat on the body. So it's very important to kind of shower every day. Also, it produces that overwhelming smell of sweat. So
Okay.
that's one way the normal flora affects the body when you're in menopause.
Okay.
The other smell, which you've probably noticed it as a little child and you really didn't understand what was going on, you just know, what is that smell? It's the fishy smell.
Oh my goodness.
So women suffer from um, it's called a triethylemera. It's a long name, which is a rare condition in a woman's body that give off a strong fishy smell. And when that woman has this naturally, menopause amplifies that smell. So the estrogen levels and the progesterone levels are likely at fault for that increased smell of fish, the fishy smell. But again, hygiene is really important when it comes to menopause.
Okay.
The fishy smell originates in the vagina, which might be indication of infection or further treatment. So you can't always say, oh, it's just the menopause smell. So you probably need to go and get that kind of checked out. Mention that to the doctor.
Okay.
The third smell is more of a fruity smell in menopause. And this is another smell. It is diabetic ketoacidosis. And when you produce this smell that you can smell it in the breath actually. And it's potentially life threatening because it's a complication of diabetes. And this occurs when the body is not producing enough insulin and it starts breaking down the fats in the body, which leads to a buildup of acid in the blood. So,
Okay.
women that have diabetes are at higher risk for complications since the hormonal fluctuation can affect the blood sugar levels and how the cells respond to the insulin in the body. Our fourth smell is the, I'm sorry, yeah. Our fourth smell is the acidic smell that some women may have. Some women report acidic or ammonia like smell with their urine.
Mhm.
And there's a possible cause of urine smell because of it's more pronounced because of dehydration. We talked about that last week. We talked about dietary habits, and also urinary tract infections is a key factor here as well. Um, I'm sorry, according to the US Department of Health and Human Services, more than half of women develop urinary tract infection at some point of their life. However, because of the midlife hormonal shifts, the it can affect vaginal flora acid and increase the women's risk of UTI and urinary, which is urinary tract infection. If you guys didn't know what the UTI meant, um, so both which can make the urine have an ammonia-like smell, and it can disrupt the sleep patterns of the woman at night. So there again, there's another added risk for insomnia. The woman's not sleeping because either they're having these night sweats, and now it's because of the urinary tract infections, which keeps them running back and forth to the bathroom. So
Right.
remember, when the estrogen levels decline, bad bacteria can multiply and increase the risk of urinary tract infections.
Gotcha.
Lactobacillus, which we mentioned earlier, it produces an acid that lowers the pH in the vagina. It's called the good bacteria, which
Okay.
is the normal flora, which is always present in the vagina. And this controls infection. Like I said, you never want your body to be just without any bacteria. You can't have, some people may want a body that's bacteria free, but it's not healthy. So some other reasons why menopausal changes increase the risk of UTI is, remember from last week, weakening of the pelvic floor and drooping of the pelvic organs. Like I mentioned, you can have like uterine prolapse, you can have a pelvic organ prolapse, urinary leakage, which means your uterus is not as strong. You don't have the muscles that you had, they're weakening. So, therefore, you may get what we call incontinence. That is when the bladder kind of leaks out, the urine leaks out of the bladder,
Okay.
either by laughing or coughing, sneezing, any of those things. You don't have control over it. Also, difficulty emptying the bladder, which means with the urinary tract infection, you constantly have the urge to go to the bathroom and you may urinate small amounts, but you're not emptying the bladder entirely. Also, thinning and dryness and irritation of the vaginal tissues, which remember we talked about the estrogen last week and how they supply the mucous membranes with moisture, and when that dips, then you'll have a dryness in the vaginal area.
Okay.
So my soapbox moment is urine sitting in the bladder for extended periods of time can cause urinary tract infections. So, my advice to you is to go pee when you have the urge to go. Don't hold it in. And as I mentioned in the previous show, it's important to partner with your physician, but it's even more important to partner with yourself. So listen to your body. Pay attention to what your body is telling you. And although UTIs can be treated with antibiotics, that's not something that you want to do all the time. However, the key to UTIs is prevention. You don't want to get them in the first
Why
place.
why wouldn't a person want to just take the antibiotics because they have a UTI? What's the problem with taking antibiotics all the time?
Well, the problem with taking antibiotics all the time is your body gets accustomed to them. They get
Okay.
used to it. So then, every time you are prescribed an antibiotic, if your body gets used to this, then you'll have to find a different antibiotic to give you that would actually work. So then, when you go through all of these antibiotics, you're at more risk for harm than you are anything, because now none of the antibiotics work because your body has gotten used to it. So you want to allow your body to fight infections in a natural way instead of always running getting an antibiotic. And we get antibiotics in so many things and we don't even realize before you even take an antibiotic, we will have to understand that the foods that we eat, if you eat meats, a lot of times the animals are treated with antibiotics. So
Okay.
therefore you're getting antibiotics through the meat. So, by the time you actually need antibiotics, you've, had a over, you know, I guess, over accumulation of antibiotics because of the antibiotics that you've gotten unknowingly.
Gotcha. I would like to ask, so we're talking antibiotics. Is there anything that a woman can do other than, like you said, the antibiotics? What can a person do naturally, or what can a person do to prevent some of these things from happening with these imbalances, urinary tract infections? Um,
Well, we will talk about some of the other ways that we can prevent these things from happening, I guess, as we go on a little bit more. But for urinary tract infection, it's just back to basics. The things that we learned earlier as children, wiping from front to back.
okay.
And you want to make sure this one, you want to urinate after intercourse, and you want to take showers rather than baths,
Okay.
because the bacteria sitting there, you just want to kind of wash all of the bacteria off your body.
Sure.
Avoid using harsh soaps and feminine hygiene products. Examples, deodorants, if you're putting them places other than under your arm, just to kind of keep you fresh. It can inflame the sensitive area in the skin, and that's another infection, and it's painful. So you want to kind of stay away from those things. And I know that we kind of talked about, well, one of the big things is douches. Do we douche? Do we not douche? We don't know. That's a big thing that was years ago, but now it's kind of calmed down. But we want to avoid douching. You want to use a unscented soap to wash just around the outside of the genital area. and don't want to stick anything in there to clean because um, the vagina is a self-cleaning organ. It doesn't need any help because that's how God designed our body. You want to flush out you're going to flush out the normal microbes, as well as temporarily changing the pH in
Got
your vagina. So that's why you don't want to put chemicals or extra anything in there. Just kind of let it do its thing.
Okay.
And
What?
also, another thing, you can take probiotics, which
Mhm.
probiotics flush out bad bacteria. The bad bacteria we talked about earlier, and that bad bacteria may be one of the culprits in causing the unwanted smells.
Okay. Okay. So I just wanted to kind of go back because I know it's like a misconception. We actually have a call, hon. Let me take the call. So the lines are opened up. Let's take this call. You gonna take the call? Oh, I guess we missed that call. They'll call back, I'm sure. Okay, so something that you said just really surprised me. Okay, so all my life I thought if you smell like fish, you got some stuff going on, some bad stuff. So it's good to know that if you do have that fishy odor, maybe it's not always because you have poor hygiene. Maybe
Mhm.
it's because
Exactly.
of menopause. Um,
Exactly.
I know that like puberty, during puberty, uh,
Hmm.
girls may have a odor to them as well. So
Right.
that's good to know that caller is back. Caller, give me 1 second. We're gonna get you through.
And while you're doing that, usually with girls with puberty, we probably would look more towards hygiene. This is new for them. So they're making sure that they're cleaning and doing things like that probably hasn't kicked in yet. So,
Absolutely. Caller, if you're still watching, please give us a call back. Are you there, caller?
I think I am. Can you hear me?
Oh, yes, I can. Welcome to the show. You're watching In and Know Live on
Oh,
WJZZ Cool
great.
TV. Nurse Keisha is here with us today. We're talking female health and wellness. Do you have a question for her?
I sure do. First of all, you both of you ladies are beautiful, but I have a
Thank
question for
you.
the nurse.
yes.
So, you hear of all these steamings going on now, all right? So, I'm thinking to myself, just watching this stuff, okay? I'm like, well, now is steaming, there's a couple of things. Is steaming taking the place from back in the day when people used to do dishes? And then now it's really caught a hold. So you see everybody. I even go on Facebook and I see these ladies making up their own steam stuff. So if one was well, first of all, what does steaming do? If one was interested, what would be the best route to go to purchase them? Because I mean, I just don't want to be buying stuff that people have made out of their kitchen. I mean, can you tell us a little bit about that? I just wanted to know about that.
Caller, I got a question for you first. What the hell is steaming? What is that?
Yeah.
Is they put these herbs in this thing and you sit and they give you like this big tinted gown and you pull it over this
Oh,
steam over something that looks like a toilet or a potty seat or something like
I've
that,
heard of that.
and it steams all those herbs up in your vaginal thing. And I don't know what it does. It's supposed to tighten you up. Is it supposed to clean you out? Is it supposed to give it some aerotherm? Well, you know what I'm trying to say.
Aromatherapy.
Make it be aromatic. I don't know. That's what I want to know. What does it do?
Nurse Perry, do you know anything about the steaming?
Well, actually, that's pretty new for me. And like I said, I am big with aromatherapy, with doTERRA, especially because the other essential oils may not be as pure. And I am confident in doTERRA. So just to know that they're putting in essential oils, we haven't got to that. I haven't heard anything with doTERRA yet that we're doing the steaming. So it kind of makes me a little bit uncomfortable. I couldn't really advise on that. I know you have to be careful with putting certain essential oils in different parts of the body. I know that for a fact. So you have to make sure that essential oil is compatible with that part of the body with the mucous membranes. You know, I couldn't advise, but I'll have to check into that.
And caller,
Right, because There are spas now. You can actually go to the spa and get a steaming.
Mm-hmm. And for one, that makes me think of the peppermint oil. Are they doing peppermint oil? Because that would burn.
Well, now
Yeah.
I don't want to be too forward, but I don't know about peppermint oil because one time, I'm a woman of a particular age, and there was a time where, was going through menopause. I needed a little bit of help, and so I kept watching that commercial. KY, the one that's making like a fire and ice, and my God, I think they might have to put some peppermint in there. Ruined the whole night. Now would ever touch it again? Okay, that's how some peppermint is. I've used peppermint wash because they have a product with the peppermint body soap, but you have to be careful where you get to. You know what I mean?
Yes.
Right.
Absolutely.
It's soft tissue down there.
Yes, it is. Yeah, and anything absorbs quickly through it. So yeah, I would be careful. But peppermint has really good properties for menopause. Like I said, with the night sweats, with hot flashes, it balances balances the temperature of the body. So if you're sweating, you can sniff the peppermint oil. You don't have to put it down under or anything like that, or you can put it on the sides of your temple. You can put it up under your nose, but I don't think I would put it anyplace else.
And caller, I think some of the stuff is just a fad, like, different stars and, different people, they promote this stuff. But I think some of it is just a fad, and it's really not any medical, it's not anything that's going to help you out medically or help you out. I think so. It might make it like you're talking about the peppermint. If you are inhaling all these peppermints in this big gown and you just inhaling it, your body gonna feel good and cool and fresh at some, you know what I'm saying. But I don't think it has any type of real properties to it. I just don't. I think some of that stuff is just a fad. I really do. Yeah.
Right, because they did it on the Red Table Talk. Both Jada, her daughter, and her mom did it.
Okay.
And they didn't really say, what they did. I mean, they said that it makes you feel better and all the rest of that, but they didn't really say what it did as it related to being intrinsic to the body. I'm just curious.
Exactly.
And you know what, caller? Another thing too, I would suggest, if that's something that you really want to kind of experience, what I would do is, because you have a lot of healthcare providers, especially nurse practitioners, that are opening up health spas. So I would go to one that they're the owner of, where they're actually doing the treatment. So they have done the studies and the background to see how safe it is, and they are professional. So
and I bet you that type of procedure is not like regulated. You know what I'm saying? I bet you can just open up a spa and you can just put a lady in a big gown and put some steam up in her.
Yeah, right.
You know what I'm saying? So yeah, you definitely got to be careful. If you guys just give me 1 second, I'm gonna take a station ID caller. I want you to stay with us. You are watching In the Know live on WJZZ Cool TV. We are streaming live on Facebook, YouTube, Twitter, Twitch, and other top social media networks. Please like, follow, and subscribe. Thank you for watching WJZZ Cool TV, the coolest station in the world. Again, caller, those are very good points. Nurse Keisha is here to try to help us figure out some stuff. Do you have any more questions for her today?
Yes, I did have another question about her. Now, without trying to get too, personal or to, but I want to answer my question answered. So I went through menopause, but I guess you stay in menopause. I don't know. But at one time I had a lot of symptoms, but they seem to have subsided.
What were some of your symptoms? I'm
going to try to be politically correct and say I went through the Sahara syndrome, like Sahara Desert, if you know what I mean.
Hot flashes.
Yeah, but not only that, I'm just gonna tell like it is. I was dry, like Sahara Desert.
Okay. Understood.
I got you.
At one time, but when you use certain things, to help you out, you get all kind of other different stuff. Like, baby oil is not a good one, I wouldn't say. You have to be careful of what you use. Now, what I found worked best Hate to say it, was something that had silicone. But because it had silicone, I didn't know whether or not that is something that you should use, or is there anything natural that a woman can use to help her out in those cases?
Well, actually, when you're having those symptoms, I would suggest talking to the doctor because they have different forms of treatment. Some will work, some won't. And that's just the whole purpose of finding one that works best for you. Like I said, I like doTERRA. doTERRA has a lot of different lubrications, natural treatments where it's not going to upset the pH, it's not going to cause harm because it's natural.
Right.
So my suggestion, I would always encourage using natural first. And if that doesn't work for you, then maybe you can reach out and see if, the doctor can prescribe something else for you. But I would always start with the natural remedies.
I ask you, what is doTERRA and where would I find it? Is that something over the counter?
No, it's not. Actually, it's a website, and I will give you that website. I'll give that to you.
Leave us your information, and we will definitely get you in touch with the doTERRA website. Okay.
Okay. Well, I'll put it in the chat. I'll leave my information in the chat. Thank you, ladies.
Absolutely. Thank you.
Thank you. Thank you so much, caller. You have a wonderful day. Okay, Nurse Keisha, that was an awesome caller there, wasn't it? Very interesting.
Yes, it was.
Very interesting. So we left off on things that you can do to prevent these types of infections. I know that sometimes, like, the clothing that you wear can help cause these types of infections.
Yes.
Like, I remember as a child, I was a big swimmer. I was always told to take my swimsuit off. Don't just walk around with your swimsuit on after you swim. So tell us some of the things that are those some of the things that can prevent these types of infections? Those types of things, do they increase the infection, or what's your take on that, hon?
Well, I guess more so the clothing, I would look at it as being comfortable. If you're having hot flashes, that means you're getting this surge of constriction in your blood, and you're burning up. So therefore, you want to wear clothing that's light, cotton, where you can breathe, because you don't want to experience that period of the hot flashes, and then you are overdressed. At that point, you see women, they're just pulling off clothes and things like that. So that's the whole deal surrounding clothing in menopause. You have to dress to wear. I mean, you can layer if you want to wear a jacket, and just in case you have to take clothing off, be able to do that, instead of dress, to where you have to leave everything on because you're going to expose yourself.
Okay. So basically, I was leaning more toward like the yeast infections, UTIs, tight clothes.
Yes.
If you wear those sorts of things, are you more prone to have those types of infections with all that moisture, and you got on these tight clothes, thongs, wet swimsuits? Will that make you more susceptible to having these types of infections?
Well, for menopausal women, I wouldn't think that the tight clothing and all of that would cause yeast infection, because remember, the moisture is not all that moist anymore. The dryness has come in. So I don't see where, you just want to dress comfortably. You want to dress where air can circulate, through the area. So.
Okay, great point. I want you to tell us the difference, because a lot of people might not know. Tell us the difference the difference between getting your tubes tied versus having a hysterectomy. What is the difference between those two procedures?
Getting your tubes tied is called a tubal ligation or tubal sterilization. And according to the Mayo Clinic, a tubal ligation is a form of permanent birth control, is the reason why you would have it done. And during tubal ligation, the fallopian tubes, remember we talked about that long little tube, and then you have the little almond shaped ovaries at the end last week. So it's during the tubal ligation, the fallopian tubes are either cut, they're tied, or they're blocked, and this it permanently prevents pregnancy. And this process is done to prevent the eggs from traveling from the ovaries through the fallopian tubes. Also, it is used to block the sperm from traveling up through the fallopian tubes to the eggs. So a tubal ligation puts the woman at ease during sexual intercourse, because then she doesn't have to worry about birth control anymore. A tubal ligation also does not affect the menstrual cycle. You'll still have the menstrual cycle. However, tubal ligation can be a way to prevent contraception, but it does not protect against sexually transmitted diseases. So you still have to be protected during sexual intercourse.
Gotcha.
So
go ahead. I'm sorry.
Are you sure?
Go ahead.
Okay. So the hysterectomy, on the other part, is a surgical removal, remember, from last week, of the uterus, the little area that houses the baby during pregnancy, which is called the womb. Depending on the overall health of the woman, other female organs may be removed also. Remember, we talked about the fallopian tubes, we talked about the ovary, we talked about the cervix that could be removed as well. That's going to depend on the doctor and exactly the reason for the hysterectomy. Most of the surgical interventions are done by a laparoscopic approach, which means it's a little bitty, it's like a little camera, a little incision that will poke in your abdomen. It depends on where the doctor's approach is. And it's a little bit easier than years and years ago. So what is done for a hysterectomy is the instrument is placed, it places tiny little what we call little lap sites. It's like a little bitty incision, which after they're done, sometimes they just put Band-Aids over it. And they would remove the uterus from those little lap sites. And the tubal ligation is a laparoscopic procedure as well, and it's performed a little incision, which is placed right under the navel, and that therefore they can pull out the fallopian tube.
Gotcha. So with either of these procedures, I know I've heard of instances where things don't go quite right, or special things, or unexpected things happen. Mm-hmm. So with either of these procedures, can a woman still get pregnant?
So with the tubal ligation, looking at what the research says, 1 out of every 200 women will become pregnant after a tubal ligation. And if you really think about it, that the chances are very slim. 1 in 200.
Yeah.
So a hysterectomy, which is the removal of the uterus, and we have to think through the process. Remember, the uterus, again, is the womb where the embryo, which is the baby, attaches itself and grows during pregnancy. If you don't have the uterus, what will the baby attach itself to? Gotcha. So if they remove the uterus, then there's no place to house the baby during pregnancy. So usually no.
Gotcha. Okay. So with either of these procedures, last week I know we discussed bleeding briefly. With either of these procedures, and I know you discussed what was it? I can't remember what the name of it was, but you discussed reasons for a person to have a history. Reason why.
Oh, yeah. So fibroid tumors, if you have a heavy menstrual cycle, abdominal pain and discomfort, or just severe symptoms from menopause. Yeah, those would be the reasons for a hysterectomy.
So with either of these procedures, once you have something like this done, would a woman continue to bleed?
So remember, with tubal ligation, yes, you will bleed. You will continue to have your menstrual cycle. If you were having a menstrual cycle before, you will have one after. Hysterectomy, remember, as soon as they perform the hysterectomy, it automatically puts you into menopause. So no, you would not have a menstrual cycle after the hysterectomy.
So at that point, a woman should not experience any types of bleeding.
So what I would say is initially during surgery and maybe a few days, maybe a week or so after, you may see a little spotting here and there, and that's going to be normal. But to have a full-fledged menstrual cycle after that, no. And that's something you should bring to the attention of your physician.
Okay, gotcha. Okay. Okay. So last week we also discussed the difficulties of sex after menopause. I just want to touch on this a little bit. So sex, like you said, it's a natural thing. Um, After menopause, you have certain complications, dryness, and all that good stuff. For the people that indulge in things like anal sex, I would like for you to discuss some of the risks um, that are involved with a person having anal sex.
All right. So that's a good question. Very good question. So we're going to start at the top. There was a study completed by Taylor, Wyndon, and Wilson in a longitudinal study, which was completed in 2015. And it reported even though sexual activity continues on into older ages in the United States, that there are gender specific declines in sexual activity with age. And they saw that in both men and women, along with lower levels of condom use and lower levels of safe sex practices. So, the physiological changes during menopause can cause urogenital changes, again, the vaginal dryness, the mucosal thinning, which can increase the irritation during sexual intercourse, and also infection is easier to be transferred through the membranes during intercourse. So, therefore, it sets the individual up for sexually transmitted diseases.
So we're talking anal sex, right?
Yes,
Okay.
yes,
It says
uh,
for sexually transmitted diseases.
yes.
Gotcha.
So
Okay.
also another sexually transmitted disease that we kind of briefly discussed last week, the HPV, the the virus. I can't even talk. So papillomavirus. It's an extremely relevant virus, and they do have a vaccine for it. If I'm not mistaken, now I think it's 3 different types of vaccine because there's different strands of it.
Okay.
So almost 85% of adults between the ages of 18 and 65 will have at least one strand of this HPV virus in their lives. And also almost like 50% of Americans have it right now. But these individuals, their immune systems can fight and clear this virus to where it'll make it undetectable.
Gotcha.
But if an infection is in the body and it persists, it can still remain in at least 10% of those people. And there are people at risk for these people are at risk for developing like genital warts, precancerous cells, or cancer linked viruses.
Wow.
And as women, they are, and women as they age,
Uh-huh.
they are less likely to eradicate those carcinogenic viruses from the body because the immune system is not as strong as it was when they were younger. And also, something that contributes to that is the autoimmune system, illnesses that a person may have, and also some drugs can also impact the ability to fight off those viruses as well.
Wow. Okay. So I know that there are a lot of ways that a person can develop cancer, vaginally, orally, and I know, like Douglas. Michael Douglas, he had some sort of oral cancer because he was indulging in uh, what you call that? He was having, he was going down on his wife. Okay, I'm sorry. I can't think of the term right now, Nurse Keisha.
Fellatio.
But yes, he was having oral sex with his wife. Okay, so I like to briefly discuss, some of that, and if you could just kind of touch a little bit on the different cancers that a person can catch, the different the different diseases that a person can catch by not having protective sex.
Okay, so I will just kind of discuss, which will lead into that. According to the American Cancer Society,
Uh-huh.
which this HPV is very, very prevalent. So most at first they did research, and the research was done with individuals that had AIDS, and they noticed that this HPV was a little bit more prevalent. But now the American Cancer Association states that most squamous cell and cancers are linked to infection with HPV. And
Wow.
HPV is a group more than 150 related viruses, the
Wow.
same group of viruses that cause cervical cancer,
Oh, wow.
as well as other kinds of cancers. And they also mentioned that women with a history of cervical cancer or pre-cancer have a increased risk of anal cancer.
Wow.
Right. So HPV can infect cells on the surface of the skin and those lining the genital, anus, the mouth, the throat, but not the blood or internal organs, such as the heart or the lungs.
Okay.
HPV can spread from one person to another during skin to skin contact.
Wow. Wow.
One way HPV spreads is through sexual activity, including vaginal, anal, or even oral sex. Different types of HPV cause warts or different parts of the body on different parts of the body. So, some cause common warts on the hands, the feet, and others tend to cause warts on the lips and on the
On
tongue.
feet?
Exactly. So HPV is not something that we should look over lightly because it's there and it's been here for years.
Yeah.
And also, I kind of thought this was really important. Just because you've been diagnosed with HPV during postmenopause for the menopausal women, it doesn't mean that you contracted it after you have gone into postmenopause.
Uh-huh.
It could be that you've had this years prior to, that
Wow.
this HPV can lay dormant in your body for years or even decades before it becomes active later in life.
Oh,
And they're
wow.
also showing that it tends to become active, I guess, around 50 or so during menopause.
Uh-huh.
So many people are aging. We got to understand that with their uteruses intact. Everyone doesn't have a hysterectomy. Everyone doesn't need to have a hysterectomy.
Uh-huh.
So that makes them vulnerable to cervical HPV.
Okay. So with it laying dormant for all those years, and you said menopause could be the trigger. Are there any other triggers that, could actually bring out the dormant HPV? Is stress,
Well,
you
I
know?
was what I could say is because like they stated, HPV has many different strands, just like the flu and just like COVID. So
Yeah.
it mutates. It's different strands. So I mean, the studies show that at 50 it can trigger it, but not to say it will not. It cannot trigger it before then because we're still learning about this.
Okay.
And even so, that reminds me of a young woman having a hysterectomy, and the doctor is like, "Oh, you don't need to go and get checked. You're fine. No pap smear or anything like that."
Yeah.
Because this is still new to us and we're still learning. I would encourage those women to continue to go and get screened, especially for HPV, and also to have a anal pap, which is just a smear.
Wow.
So therefore, you're
Never heard
knowledgeable.
of an anal pap. So that's not. Hold on 1 second, honey. Let me give
Mhm.
you one more station ID. You are watching In the Know Live. It is getting heated up in here. We are streaming live on Facebook, YouTube, Twitter, Twitch, and other top social media networks. Please like, follow, and subscribe, and give us some comments. Thank you for watching In the Know Live on WJZZ Cool TV, the coolest station in the world. Back to this anal pap. I have. You're not talking about a colonoscopy or any of those types.
No, all it is just a swab, and they just kind of swab the anal area and look to see if there's any cells, abnormal cells, or anything. So, and it's like it's um a preventative treatment for cancer. That's what we're looking for
Okay.
because HPV, it runs along that track of cancer. It can promote cancer. So that's what we're looking for.
So let's make
And this
you can
this
have cancer. You can have anal cancer as well.
exactly.
Okay, so HPV will cause anal cancer as
Yeah.
well. Okay,
Yeah.
gotcha. Wow.
So you want to screen not just for HPV, but for anal, to do the anal swab as well. And right now, there's no certain time that you need to have this done. My suggestion would be just if you're going in yearly to make sure you put that on your calendar to say, hey, by the way, I need a HPV test and I also want an anal swab. And that's if you know that you've had multiple partners. Just because remember this thing can lay dormant in your body.
Okay, so let me ask you this. So you've had so would a person that does not indulge in anal intercourse have a anal swab?
I don't think it's necessary. No.
Okay,
If you know that you're putting yourself at risk, if this is something that you indulge in, if this is your practice, then yes, especially with multiple partners, yes, you want to get swabbed just to make sure.
Wow. Okay. The lines are open, guys. If you all want to talk to Nurse Keisha, please chime in. This is a very interesting conversation. She has definitely put me up on some stuff that I had no knowledge of. So definitely chime in. We are definitely getting into some serious conversations regarding the female health. Males are included as well. But I just wanted to touch on the breast cancer. At what point should a woman, you talked about the anal cancer, when you should have that swab and this and that. At what point should a woman actually start having her breast cancer exams? And we do have another caller. Give me 1 second, Nurse Keisha. Let's take the call. Caller?
Oh, hi.
Hi, caller. You're on the air.
I wanted to tell the nurse that when she was talking about the warts, I just had a story to add along with it.
Go ahead.
And what had happened was, I'm trying to find my
We're talking about the wart. Caller, can you cut your radio or TV
I
down?
I just found my remote. That's what I was trying to do.
Okay.
So it was a lady I worked with, and her son had to continue to get surgeries in his throat when she birthed him, and come to find out that he had warts in his throat. So I asked her, how did her son get warts in her throat? Well, she finally told me one day that she had genital warts. And when he came out of the vaginal canal, that mucus and everything else, the doctor said it must have got into there. So whatever she had in there, it caused warts. So he could hardly ever talk. He would have to go get those warts removed all the time.
Wow.
And he was just a small baby. And he kept losing vocal ability too. So I don't know. It was a while back. So I don't know whatever happened to those people, but I'm just saying that thing is real. So people, when they're out here, they really should. And then that scared me to hear the nurse say that it's skin to skin, and that made my nerves bad. Now, me, on the other hand, because I'm spiritual, I believe that, now that I've grown, I believe in that you marrying spirits together. So I'm be careful who I mess with, okay? Because I'm not merging my spirit with everybody.
Yeah.
But when I heard things like that, and then one other thing I just want to say to the nurse, I know you didn't speak of this, but this happens too. One time I had to take my daughter, this is way years ago, because she's older now, she's 35, but I had to take her to emergency. Next to us, it was this lady, and she was moaning and crying. And me and my sister was like, what is wrong with her? But this moaning was just so deep, you knew that this lady was in pain. So the doctor came in, he said, you wanted your sister? He said, you can tell your sister to leave. She was like, no, whatever you tell me, you can tell my sister too. He was like, you probably want her to leave. She was like, no, she can stay here. Just tell me, doctor. She had syphilis that had jumped the
God.
metabolic barrier of the brain, and it got into her brain.
Wow.
Yep.
I keep that story in my head. I remember the genital warts, and then there's people out here now just doing everything. So you just never know about some of these people.
Yes.
And then, like I said too, because I'm more evolved now as I've gotten older and more emotionally mature, and I don't live by my flesh. You know, it's about marrying spirits together. So you've got to be careful about that and everything else. So I just wanted to add that, nurse. When you were talking about those warts, you are right. And when people are pregnant, I mean, they think it just happens to them, but you don't know what else you're affecting out here, you know?
Absolutely. Absolutely. And that's a very good point, caller. I'm going to have to let you go. I thank you for calling in today. We are nearing the end of our show. But
Thank you.
Thank you so much. Definitely leave your information in the chat, and Nurse Keisha is going to get you that some information on everything we discussed today. Okay. Okay, so we are nearing the show. This has been a very interesting show. Nurse Keisha, we did not even finish all our questions. This is a serious topic. And like the caller was just saying, women definitely need to be aware of who they're with, what they're doing. Don't just take whatever a person is telling you and put your health at risk. Your health is of importance. Your your mental state, your physical state. There's some things out here that you actually can't get rid of. Like you said, there's some things that are dormant. So you just gotta protect yourself in this day and age. Okay. I'm gonna give you the floor, Nurse Keisha. I want you to just kind of give us some encouraging words as we end the show today.
Okay, so we talked about menopause last week and this week, and I appreciate you inviting me to the show so I can educate my community. I love it. So these couple of weeks, you're not going to be an expert in menopause, but you will be knowledgeable enough to where you can advocate for yourself. You kind of know how this menopause thing works. You know what signs and symptoms to look for in menopause. So remember, going to the doctor, if the doctor's like, oh yeah, you're depressed, I'm going to put you on an antidepressant. Oh yeah, so we're going to put you on some thyroid medication because it's your thyroids. And those things can mimic menopause. Okay. So before they start putting you on medication for depression, because basically all you need to do is balance your hormones. And once you do that, the depression subsides. And we also mentioned a little bit last week about mental health. Mental health when it comes to menopause is real. So if you're in menopause, post-menopause, and you feel that you just are not coming out of this, I strongly suggest that you look to your doctor for some assistance, and maybe they can get you on some low dose medication and also therapy. Okay. I don't want you to feel that nobody understands. You're out here by yourself and you don't know what's going on with your body. Take control, take charge of your body, know your body, learn it.
Absolutely. Well, we are going to sign out now. Nurse Keisha. I said Nurse Lakeisha. Hey, Lakeisha LeGrand, I'm thinking about you, girl. Nurse Keisha, I just want to say I really appreciate you coming on to the show for the last couple of weeks. You have given me some serious information that I did not know. I'm an EMT. I thought I kind of knew most of this stuff, but you've definitely given me some additional information. You are always welcomed here at In the Know. I want you to come back and just, continue some discussions at some point. I just want to let everybody know we're going to get her information. We'll post everything so you all can get in touch with her. And I just want to tell everybody, thank you so much for joining in with us today. You have been watching In the Know Live on WJZZ Cool TV, the coolest station in the world. Thank you again. I will see you guys next week. Stay woke.
And be great.
Yes.